Hello and welcome. Today we're delving into a group of neurological disorders known as Spinocerebellar ataxias or SCAs. These progressive conditions affect coordination, balance, and movement, significantly impacting the lives of those affected. Let's explore what SCAs are, what causes them, and how they're managed. Spinocerebellar ataxias are primarily genetic disorders. This means they are passed down through families. The most common cause involves mutations in specific genes that lead to abnormal proteins being produced. These mutated proteins disrupt the normal function of nerve cells, particularly in the cerebellum, spinal cord, and brainstem. While most SCAs are inherited, some cases can arise spontaneously due to new genetic mutations, although these are less frequent. The underlying problem in SCAs lies in the gradual degeneration of neurons within the cerebellum, spinal cord, and sometimes the brainstem. The cerebellum, located at the back of the brain, is crucial for coordinating voluntary movements, maintaining balance, and motor learning. Damage to this area leads to ataxia, the hallmark symptom of SCAs. The spinal cord carries signals between the brain and the body, and its degeneration can result in impaired sensation and muscle weakness. Ultimately, this neuronal loss disrupts the complex communication pathways required for smooth, coordinated movement and other essential neurological functions. Spinocerebellar ataxias are considered relatively rare disorders. Their exact prevalence is difficult to determine because there are many different types of SCAs, and diagnosis can be challenging. The prevalence varies among different populations and geographical locations, partly due to founder effects, where specific mutations are more common in certain regions. Some types of SCA are more prevalent in certain ethnic groups than others. Overall, SCAs affect individuals of all ages, but symptoms usually appear in adulthood, most commonly between the ages of 25 and 55. The signs and symptoms of spinocerebellar ataxias vary depending on the specific type of SCA and the individual affected. However, some common features include progressive ataxia, characterized by difficulty with balance and coordination. This can manifest as unsteady gait, frequent falls, and difficulty with fine motor tasks like writing or buttoning clothes. Other symptoms may include slurred speech, difficulty swallowing, involuntary eye movements known as nystagmus, muscle stiffness or spasticity, and in some cases, cognitive impairment. It's crucial to remember that the progression and severity of these symptoms can differ significantly from person to person. Diagnosing spinocerebellar ataxias typically involves a combination of neurological examination, medical history, and genetic testing. A neurologist will assess the patient's balance, coordination, reflexes, and other neurological functions. Magnetic resonance imaging, or MRI, of the brain and spinal cord may be performed to visualize any structural abnormalities or atrophy. Genetic testing is essential to confirm the diagnosis and identify the specific type of SCA, which is crucial for predicting the disease's course and potential management strategies. There are numerous types of spinocerebellar ataxia, each linked to a specific gene mutation. They're generally classified numerically like SC1-2, SC1 so on, SCA3, also known as Mercado-Joseph disease, is one of the most common worldwide. Each type has its own unique set of characteristics and associated symptoms, though ataxia remains the primary feature. The specific gene involved determines the rate of progression, the specific symptoms that manifest, and even the likelihood of other family members being affected. Accurate classification is crucial for genetic counseling and potential clinical trials. Currently, there is no cure for spinocerebellar ataxia. Treatment focuses on managing symptoms and improving the patient's quality of life. Physical therapy can help maintain muscle strength, improve balance, and enhance coordination. Occupational therapy assists with adapting daily activities to compensate for physical limitations. Speech therapy can address speech and swallowing difficulties. Medications may be prescribed to manage specific symptoms like muscle stiffness, tremor, or depression. Assistive devices, such as walkers or wheelchairs, can help with mobility. A multidisciplinary approach involving neurologists, physical therapists, occupational therapists, speech therapists, and other healthcare professionals is crucial for comprehensive care. Because spinocerebellar ataxias are primarily genetic disorders, there are currently no known ways to prevent the development of the disease itself. However, genetic counseling is crucial for individuals with a family history of SCA. Genetic counseling can help assess the risk of inheriting or passing on the gene mutation. Prenatal testing is available for families who wish to determine whether their child will inherit the condition. Early diagnosis and intervention can help manage symptoms and improve quality of life for those affected. The prognosis for spinocerebellar ataxias varies greatly depending on the specific type of SCA and the individual affected. Some types progress slowly over many years, while others progress more rapidly. Over time, SCAs typically lead to increasing disability and dependence on assistive devices. Recent research efforts are focused on developing disease-modifying therapies that can slow or halt the progression of the disease. Gene therapy, stem cell therapy, and targeted drug therapies are all areas of active investigation. While significant progress is being made, further research is needed to find effective treatments and ultimately a cure for Spinocerebellar ataxias. Continued research and increased awareness offer hope for improved outcomes for individuals and families affected by these challenging disorders.